Hey everyone, I'm going to be doing my systematic review on an article that is called The Impact of Exercise Interventions on Physical Fitness in Breast Cancer Patients and Survivors. My first slide just has listed the citation in APA format and also the authors and affiliators who are on this article. So, the first thing that I wanted to talk about is the research question. The research question for my study is just to determine the effects of isolated exercise interventions on selected physical fitness variables. Those variables would include cardiorespiratory fitness, strength, fatigue, and health related quality of life for breast cancer patients who are undergoing therapy. Whether that's chemotherapy, radiation, any of the above. So the study aims to assess how different types of exercise influence the outcomes of quality of life and these fitness variables, and whether exercise can help mitigate the side effects that breast cancer and its treatment brings. Some of the main findings that the article found, it just reinforces that the role of exercise is a valuable strategy for improving and maintaining physical and psychological health in breast cancer patients and in survivors. It talked a lot about resistance training and how combined um, training shows the most consistent benefits, where the patients are using aerobic exercise, Pilates, and yoga, which also do contribute to overall well being. And the results highlight the importance of just incorporating these exercise programs into cancer care. I included some graphs here um, just to summarize the included studies and key findings. So, the author, sample size, population, exercise type, the duration of the test or study is listed, and then the frequency of exercise sessions. Um, so there's a lot of different charts because there's a lot of different um, articles listed in here. But moving on, some of the strengths and weaknesses that I found in the review. First is like comprehensive and up to date review, just because systematically this article reviews the last 20 years of research. So there is new, current, and broad perspectives on the topic that aren't listed in this um, systematic review. They focused a lot on isolated exercise effects. Um, it just makes it more clear how physical activity impacts breast cancer outcomes. So that's very good. Um, the review also considered different exercise types, allowing for comparisons across interventions and helping to determine the most effective approaches for specific outcomes. Um, some other strengths would just include the inclusion of both patients in treatment um, and survivors. So they did include everything that they needed to by analyzing both the breast cancer patients and the survivors. So they incorporated all, and then they used um, assessment tools that were well established, which is great. Some of the weaknesses in the study would include the heterogeneity in study designs and exercise protocols, limited data on long term effects, just because most of the studies focused on short to medium term interventions instead of like long term sustainability interventions. Um, the sample sizes in some of the studies were small. There are potential risks of bias in some studies just due to self reported measures that they used, and then a lack of adverse events and safety. Comparing this systematic review with others, um, this review just generally reinforces the positive impact of exercise in line with previous findings. It does offer new insights into exercise modality, and it really does highlight the benefits of resistance and combined training while also addressing gaps in long term evidence. So, future research should focus on standardizing exercise prescriptions and long term follow up studies to strengthen current recommendations from doctors, physical therapists, ATs. Some practical implications that were found in this study is that professionals in kinesiology, rehabilitation, and oncology care should be actively promoting structured exercise programs like the ones used in these studies for breast cancer patients and survivors. Because the integration of resistance aerobic and combined training of this, combining all of these things into standard care will significantly enhance fitness, it'll reduce fatigue and improve overall well being. So, these are um, efforts that should be focused on um, individualizing the patients, making sure that the patients are supervised, and making sure that patients have a long term exercise intervention to optimize their outcomes. And lastly, just some future research that could be done that hasn't been done yet. It could focus on establishing standardized exercise protocols to improve like the comparability across studies and investigating long-term effects of exercise beyond just the typical 12 to 24 week interventions. Just most studies are needed on personalized exercise programs tailored to the cancer stage, as well as the mechanisms behind fatigue reduction, treatment type, and patient fitness levels. Um, Also, research should address safety considerations and adverse effects, especially for high risk patients. Um, and these studies should also explore strategies for integrating exercise programs into oncology and rehab settings to enhance accessibility and adherence. Um, so, overall, the review is well structured. It has valuable information to understanding the role of exercise in breast cancer patient care. It does effectively highlight the benefits of exercise, and it also acknowledges limitations related to study design, sample size, and potential bias. So, future research should focus on standardizing these exercise protocols, assessing long-term outcomes, and evaluating safety considerations to further strengthen evidence bases. Yep.